Rheumatic heart disease is long-term damage to the heart valves. Here is how doctors manage it. Rheumatic heart disease follows rheumatic fever, an immune reaction after an untreated strep throat infection in childhood. The immune response scars the heart valves, most often the mitral valve, making them stiff or leaky over time. Watch for new breathlessness, swelling in the legs, palpitations, or reduced ability to do familiar activities. An echocardiogram, an ultrasound of the heart, is the main test doctors use to track valve disease over the years. The most important step is preventing another rheumatic fever attack with regular penicillin injections, usually every 3 to 4 weeks. Doctors also prescribe medicines tailored to symptoms: diuretics for fluid, beta blockers for rhythm, and anticoagulants when clot risk is high. When the mitral valve is severely narrowed, a balloon procedure can open it through a catheter, avoiding open heart surgery. When valves are too damaged, surgeons may repair them or replace them with a mechanical or tissue valve, each with its own trade-offs. Daily habits matter. Take antibiotics on time, care for your teeth, eat well, stay active within your limits, and avoid smoking. Pregnancy adds strain on the heart, so women with rheumatic heart disease are usually offered pre-pregnancy counseling and specialist care. Even feeling well, regular follow-up echoes and clinic visits help catch valve changes early before bigger problems develop. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost. Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.